In our profession, we're challenged every day with creating a natural-looking restoration. With ever-increasing aesthetic demands of dental treatments, patients not only desire the health of their teeth, but also a perfect smile. For this reason, it is important to perfectly mimic the adjacent teeth in shape and shade. There are two crucial steps for creating a natural-looking restoration: the selection of the shade in the operatory and the duplication of the selected shade in the laboratory. Although these steps may seem simple, it is extremely difficult to assess the shade of a tooth. The human eye, for instance, can be tricked into seeing a different color just by changing lighting conditions or surrounding colors. Therefore, understanding the science of color, eye perception, and the factors affecting the selection of shade will simplify the shade selection process and allow for fewer remakes, chair time loss, and cost. To break down this puzzle, we need to understand primarily what is color. The color of an object is determined by the light that enters the human eye, which is reflected from the surface of that object. Light is an energy, a part of the electromagnetic spectrum, where the eye is only sensitive to the visible portion of the spectrum, 380 to 750 nanometers. Each individual wavelength within the spectrum of visible light is representative of a particular color. The predominant colors are red, green, and blue corresponds to a particular length. Blue has a short wavelength, green has a medium wavelength, and red has a long wavelength. There are only two basic ways, however, of mixing color: additive and subtractive. The additive color system involves light emitted directly from a source. The additive reproduction process mixes various amounts of red, green, and blue light to produce other colors. Combining all three primary colors produces white. All visual devices utilize the additive color system to gather the information needed to reproduce a color image. Whereas objects, such as an apple, present color by subtracting or absorbing certain wavelengths of color while reflecting other wavelengths back to the viewer by subtractive color. It involves colorants and pigments that reflect light. Subtractive color starts with an object, such as paper or canvas, that reflects light and uses colorants, such as pigments or dyes, to subtract portions of the white light illuminating an object to produce other colors. Subtractive process allows everyday objects around us to show color. Knowledge of primary, secondary, and complementary colors is necessary in order to control and alter restoration shades for a predictable, aesthetic, restorative outcome. Color essentially is influenced by light source, the object property, and visual perception. Light sources, either natural or artificial, are capable of emitting light. In other words, they're a source of illumination. An example of natural light source, such as natural daylight, which is closest to emitting the full spectrum white light and is often used as the standard for judging light from other sources. Artificial light sources, such as incandescent light, which emits high concentration of yellow waves, and fluorescent light that emits high concentration of blue waves. Most dental offices are outfitted with incandescent or fluorescent lights, while dental chairs usually have LED light source. Colors that are seen under these light sources can differ noticeably when seen under daylight. These light sources may not be suitable to perform dental shade matching procedures. In order to have proper illumination, color-corrected lights that have a color temperature of approximately 5,500 degrees Kelvin and a color rendering index of 90 or more should be used. Color rendering index, which indicates how well a light source renders color as compared to a standard source northern daylight. CRI, scaled from 0 to 100. Color temperature, which is a measure of the light source color when illuminated and is measured in degrees Kelvin. Northern daylight has an average color temperature of 6,500 degrees Kelvin. Many possible interactions may occur between the visible light and the object. The light wave could be reflected, absorbed, or transmitted by the object. So the color is not in the object itself, but in the light that strikes the object and ultimately reaches the eye and evokes the sensation. The human eye is equipped with a variety of optical components. Conversion of the light stimuli or images into signals and transmission of electrical signals containing the vision information from each eye to the brain occurs through the optic nerves. This information is further processed in several stages, ultimately reaching the visual cortices of the cerebrum. This starts when an object is observed, It is first focused through the convex cornea and lens elements, forming an inverted image on the surface of the retina that contains millions of light-sensitive receptors. The center of the retina contains highly dense, tightly packed cone cells. At the periphery of retina, rod cells, which are another type of photoreceptor cell, increase in concentration and predominance as their ratio to cone cells gradually increases towards the periphery. Rod and cone cells are attributed to color vision and visual equity. Photopic vision is predominant in cone cells that are primarily responsible for photoreception. Scotopic vision are controlled by the rod cells. Under low light conditions, shapes and the relative brightness of objects can be distinguished, but not their colors. Cone cells consist of 3 cell types, each tuned to a distinct wavelength response, either short, medium, or long wavelength of light. Although the human visual system features 3 types of cone cells, it is the human brain that processes the different light wavelengths in the perception of color. Between perception of color and its interpretation, each person may verbally define an object's color differently. To objectively communicate a particular color to someone without some type of standard is difficult. There must be a way to compare one color to the next with accuracy. This led many scientists into introducing color quantification systems. Munsell color system that specifies colors based on 3 color dimensions: hue, value, and chroma. It was first to accurately organize all color perceptions. It describes a psychological and perceptual rather than physical color space. Hue, an attribute by which to distinguish one color family from another, such as red, blue, and green. Chroma is the colorfulness of a given illuminance level, in other words, the color intensity. Objects of different hues, chroma, can be identical value. Value, the lightness or darkness, that is, the attribute by which a sample appears to reflect a greater or smaller fraction of the incident light. Some visual shade matching are based on Munsell color system. However, calculating color differences between 2 colors is difficult in Munsell color system. In 1978, the Commission Internationale de l'Éclairage (CIE) introduced a method allows calculation of the difference between 2 colors using a formula called delta E and expressing that difference in numbers. The CIE lab system. The CIE lab has 3 coordinates: L star, A star, and B star. L star axis represents the lightness of the color, where 0 yields black and 100 indicates white. A star axis represents red-green. A star negative value indicates green, while positive values indicate red. B star axis represents yellow and blue. B star negative values indicate blue, and positive values indicates yellow. Instrumental shade matching devices are based on CIE lab systems. In dentistry, tooth color assessments can be done through visual or instrumental methods. The visual shade matching is basically a comparison between a tooth and multiple standards, shade guide tabs. It is convenient and most frequently used method in clinical dentistry. The first attempt to create universal standard for teeth color was in mid-1950s, when the Vitapan Classical shade guide system was introduced. It has been and still is widely used as the gold standard for shade matching, and some restorative material are keyed to it. Vitapan Classical Shade Guide has 4 hue category: A, yellow-red; B, yellow; C, gray; D, red-yellow-gray. The shade matching procedure is simply done by choosing the nearest hue and then selecting the appropriate chroma. Criticism of the empirical design of these shade guides and the color distribution led to the development of the 3D Master. 3D Master Shade Guide is based on scientific findings and the systemic coverage of the tooth color in space of natural teeth according to colorimetric CIE lab order principle. Determination of the tooth shade in 3 steps using tooth guide. First, determine the value, lightness, by selecting the closest match from one of 5 value groups. Second, determine the chroma within the value group from 3 choices. Third, pick the hue by determining if the tooth has a more yellow or red cast. However, although this guide is based on classification principle, it can be confusing and takes time to learn. A modification of the Vita 3D Master with simplified presentation has been introduced. The Linear Guide 3D Master (LG), where matching procedure is performed in a 2-step procedure. The tabs are grouped in levels that correspond to 6 lightness tabs. Each level has hue and chroma, tabs are evenly spaced, and intermediate shades can be predictably formulated. Instrumental methods of shade matching have been designed to aid clinicians in determining tooth colors. The earliest device was first introduced in the early 80s, but the inadequate design and accuracy minimized its success. A newer generation of technologies that focus on analysis and color determination were developed, such as spectrophotometry, colorimetry. A spectrophotometer measures light reflectance at different wavelength intervals over the visible spectrum. Colorimeters provide direct color coordinate specifications, sampling light reflected from an object through 3 color filters that resembles the response of the color receptors in the eye. However, the role of the dental professional is still an important factor affecting the final color match, since no device is currently available that is capable of recording all the fine details and subtle color variations present in human teeth. The factors affecting the selection of shade. Metamerism is a phenomenon where 2 colors that appear to be a match under a given lighting condition but have different spectral reflectance. The problem of metamerism can be avoided by selecting a shade and confirming it under different light conditions. Surroundings. The ambiance of the dental clinic affects the final shade selected. The walls of the dental office should be colored neutrally, avoiding bright colors, especially reds or yellows. Bright environment makes the shade appear duller, and hence a proper environment is required for an accurate evaluation of the shade. A neutral gray card in the background during shade evaluation process helps to obtain a more accurate shade. Color adaptation. Color vision decreases rapidly as an object is observed. The original color appears to become less and less saturated until it appears almost gray. Simultaneously, the chroma, intensity, of complementary colors appears greater. These 2 forms of adaptation influence the dentist, and hence the shade selection process should be done quickly, 1 to 5 seconds. Apparently, assessing color and shade matching is a vital step in aesthetic dentistry. In the absence of knowledge, color matching skills cannot be mastered effectively. Understanding the process of assessing color, factors affecting the whole shade matching practice, and limitation provided by the assessment tools will ultimately enable better solutions for this challenging side of dentistry.